Foot pain is a common issue that affects people of all ages and lifestyles. Whether it's caused by standing for long hours, wearing uncomfortable shoes, or underlying health conditions, the discomfort can interfere with daily activities. Before reaching for over-the-counter OTC medicines, it's important to understand what might be causing your foot pain. Sometimes it's due to minor injuries like sprains or strains, while other times it could be related to chronic issues such as plantar fasciitis or arthritis. In this video, we'll explore the most commonly used OTC medicines for foot pain, how they work, and what you should consider before using them. OTC medicines can be a helpful first step for managing mild to moderate foot pain. They are especially useful when the pain is due to minor injuries, overuse, or inflammation. However, it's important to recognize when self-treatment is appropriate. If your pain is severe, persistent, or accompanied by symptoms like swelling, redness, or fever, it's best to consult a healthcare professional. OTC medicines are not a substitute for medical advice, but they can provide temporary relief while you address the underlying cause. Let's look at the main types of OTC medicines available for foot pain. Acetaminophen, also known as paracetamol, is a widely used OTC pain reliever. It works by blocking pain signals in the brain, making it effective for reducing mild to moderate foot pain. Acetaminophen is often recommended because it has fewer gastrointestinal side effects compared to some other pain relievers. However, it does not reduce inflammation, so it may not be the best choice if your foot pain is caused by swelling or injury. Always follow the recommended dosage instructions to avoid potential liver damage. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID, commonly used to relieve foot pain, especially when inflammation is present. It works by reducing the production of substances in the body that cause pain and swelling. Ibuprofen is effective for conditions like sprains, strains, and arthritis. However, it can cause stomach upset or increase the risk of bleeding if used excessively. Always take ibuprofen with food and avoid exceeding the recommended dose. If you have a history of ulcers or kidney problems, consult your doctor before use. Naproxen is another NSAID available over the counter, similar to ibuprofen. It's often used for longer-lasting pain relief, as its effects can last up to 12 hours. Naproxen is helpful for chronic foot pain conditions like arthritis or plantar fasciitis. Like other NSAIDs, it reduces inflammation and pain, but may cause stomach irritation or other side effects if not used properly. Always read the label and consult a healthcare provider if you have any concerns about drug interactions or pre-existing conditions. Topical analgesics are creams, gels, or sprays applied directly to the skin over the painful area. They often contain ingredients like menthol, camphor, or salicylates, which provide a cooling or warming sensation and help distract from the pain. These products are useful for localized foot pain and can be a good option for people who prefer not to take oral medications. Topical analgesics are generally safe, but avoid applying them to broken skin or using them with heating pads. Menthol-based creams are a popular choice for foot pain relief. Menthol creates a cooling sensation that can temporarily mask pain and provide a feeling of comfort. These creams are easy to apply and can be used several times a day as needed. While they don't treat the underlying cause of pain, they can be helpful for sore feet after a long day or minor aches. Always wash your hands after application and avoid contact with eyes or mucous membranes. Capsaicin creams are another topical option for foot pain, especially for nerve-related pain or conditions like neuropathy. Capsaicin is derived from chili peppers and works by reducing the amount of a pain transmitter in the skin. With regular use, it can help decrease pain over time, but it may cause a burning sensation when first applied. Start with a small amount and gradually increase as tolerated. Avoid using on broken skin and wash hands thoroughly after use. Some topical gels contain salicylates, which are related to aspirin. These ingredients help reduce inflammation and provide pain relief when applied to the skin. Salicylate-containing gels are often used for muscle aches, joint pain, and mild foot pain. They are generally safe, but should not be used by people allergic to aspirin. As with other topicals, avoid applying to broken or irritated skin and follow the instructions on the packaging. Epsom salt soaks are a traditional home remedy for sore feet. While not a medicine in the strict sense, soaking your feet in warm water with Epsom salts can help relax muscles and reduce minor aches. The magnesium in Epsom salt is believed to have soothing properties, though scientific evidence is limited. This method is safe for most people and can be combined with other OTC treatments for added comfort. Pain relief patches are adhesive products that deliver medication through the skin. Some contain lidocaine, a numbing agent, while others may include menthol or other analgesics. These patches are convenient for targeting specific areas of foot pain and can provide several hours of relief. Always follow the instructions for application and removal, and avoid using patches on broken or irritated skin. Choosing between oral and topical OTC medicines depends on the type and location of your foot pain. Oral medications like acetaminophen, ibuprofen, or naproxen work throughout the body and are better for widespread pain or inflammation. Topical treatments are ideal for localized pain and have fewer systemic side effects. Sometimes, a combination of both approaches can provide the best relief. Always consider your personal health history and any other medications you may be taking. Plantar fasciitis is a common cause of heel and foot pain, especially among runners and people who spend a lot of time on their feet. OTC medicines like NSAIDs can help reduce pain and inflammation, while topical creams may provide additional comfort. Supportive footwear and stretching exercises are also important for managing this condition. If pain persists, consult a healthcare provider for further evaluation. Arthritis can affect the joints in your feet, leading to chronic pain and stiffness. OTC NSAIDs like ibuprofen and naproxen are commonly used to manage arthritis pain. Topical analgesics may also help, especially for mild symptoms. In addition to medication, maintaining a healthy weight and using supportive footwear can reduce stress on your joints. If OTC treatments aren't enough, talk to your doctor about other options. Bunions are bony bumps that form at the base of the big toe, causing pain and discomfort. OTC pain relievers like acetaminophen or NSAIDs can help manage the pain, especially after long periods of standing or walking. Topical creams may also provide temporary relief. Wearing shoes with a wide toe box and using protective pads can help prevent irritation and reduce pain. Corns and calluses are thickened areas of skin that develop from repeated friction or pressure. OTC treatments include medicated pads or creams containing salicylic acid, which helps soften and remove the thickened skin. Pain relievers can also be used if the area is sore. It's important to avoid cutting or shaving corns and calluses yourself, as this can lead to infection. Foot sprains and strains are common injuries that can cause significant pain and swelling. OTC NSAIDs like ibuprofen or naproxen are effective for reducing inflammation and discomfort. Rest, ice, compression, and elevation, the RICE method, are also important for recovery. Topical analgesics can provide additional relief for localized pain. If you're unable to bear weight or the pain is severe, seek medical attention. Blisters are fluid-filled sacs that develop from friction, often caused by new or ill-fitting shoes. While OTC pain relievers can help with discomfort, the main treatment is to protect the blister and allow it to heal. Use blister pads or bandages to cushion the area and prevent further irritation. Avoid popping blisters, as this increases the risk of infection. Gout is a type of arthritis that often affects the big toe, causing sudden and severe pain. OTC NSAIDs like ibuprofen or naproxen can help reduce pain and inflammation during an acute attack. Drinking plenty of water and avoiding foods high in purines may also help manage symptoms. If gout attacks are frequent or severe, consult your doctor for prescription treatments. People with diabetes may experience foot pain due to nerve damage or poor circulation. OTC pain relievers and topical creams can provide some relief, but it's essential to address the underlying cause. Regular foot inspections, proper footwear, and blood sugar control are crucial for preventing complications. If you notice sores, numbness, or changes in skin color, seek medical attention promptly. Athlete's foot is a fungal infection that can cause itching, burning, and pain. OTC antifungal creams are the main treatment, but pain relievers can help manage discomfort. Keep your feet clean and dry, and change socks regularly to prevent recurrence. If symptoms persist or worsen, consult a healthcare provider for stronger medications. Selecting the right OTC medicine for foot pain depends on the cause, severity, and your personal health profile. Consider whether your pain is due to inflammation, injury, or another underlying issue. Read labels carefully and follow dosing instructions. If you have allergies, chronic conditions, or take other medications, check with your pharmacist or doctor before starting a new treatment. OTC medicine labels provide important information about active ingredients, dosage, and potential side effects. Always check the label before using a new product, especially if you're taking other medications. Look for warnings about allergies, interactions, and age restrictions. If you're unsure about any information, ask a pharmacist for guidance. All medicines, including OTC options, can cause side effects. Common issues include stomach upset, allergic reactions, or skin irritation from topical products. NSAIDs may increase the risk of bleeding or kidney problems if used long-term. If you experience any unusual symptoms after taking a medicine, stop, use, and consult a healthcare professional. Some OTC medicines can interact with prescription drugs or other supplements you may be taking. For example, NSAIDs can increase the risk of bleeding if combined with blood thinners. Always inform your doctor or pharmacist about all the medicines and supplements you use to avoid harmful interactions. When in doubt, seek professional advice before starting a new OTC product. Certain groups, such as children, pregnant women, and older adults, may need to be extra cautious when using OTC medicines for foot pain. Dosages may differ, and some products may not be safe for these populations. Always check age restrictions and consult a healthcare provider if you're unsure about the best option for you or your family member. While OTC medicines can help manage foot pain, non-medicine approaches are also important. Rest, ice, compression, and elevation can speed recovery from injuries. Supportive footwear, orthotic inserts, and stretching exercises can prevent and relieve pain. Combining these strategies with OTC medicines often leads to better outcomes and faster relief. While OTC medicines are effective for many types of foot pain, there are times when you should seek medical advice. If your pain is severe, persistent, or accompanied by swelling, redness, or fever, it may indicate a more serious problem. Sudden inability to walk, numbness, or open wounds also require prompt attention. Don't hesitate to consult a healthcare professional if you're concerned. Preventing foot pain is often easier than treating it. Choose comfortable, supportive shoes that fit well and avoid high heels or tight footwear. Maintain a healthy weight to reduce stress on your feet. Regular stretching and strengthening exercises can help keep your feet flexible and strong. Pay attention to any early signs of discomfort and address them promptly. Wearing the right shoes is crucial for preventing and managing foot pain. Look for shoes with good arch support, cushioning, and a wide toe box. Replace worn-out shoes regularly, and consider using orthotic inserts if you have flat feet or high arches. Proper footwear can make a significant difference in your comfort and overall foot health. Regular stretching exercises can help prevent and relieve foot pain. Focus on stretches for the calves, Achilles tendon, and the bottom of your foot. Simple routines, like rolling your foot over a tennis ball or towel stretches, can improve flexibility and reduce tension. Incorporate stretching into your daily routine for best results. Orthotic inserts are shoe inserts designed to support the arch and cushion the foot. They can help redistribute pressure and reduce pain from conditions like plantar fasciitis, flat feet, or high arches. OTC orthotics are widely available, but custom options may be necessary for severe or persistent pain. Consult a podiatrist for personalized recommendations. Foot massage can help relieve pain, improve circulation, and relax tense muscles. You can use your hands, a massage roller, or even a tennis ball to gently massage the soles of your feet. Regular massage can be a soothing addition to your foot care routine, especially after long periods of standing or physical activity. Applying ice packs can help reduce swelling and numb sharp pain, especially after an injury. Heat therapy, such as warm soaks or heating pads, can relax muscles and improve blood flow for chronic aches. Alternate between ice and heat depending on your symptoms, but avoid applying extreme temperatures directly to the skin. Good foot hygiene can prevent many causes of foot pain, including infections and blisters. Wash your feet daily, dry them thoroughly, and keep toenails trimmed. Change socks regularly and choose breathable footwear to reduce moisture. These simple habits can go a long way in keeping your feet healthy and pain-free. Staying active is important for overall health, but overdoing it can lead to foot pain. Gradually increase your activity level and listen to your body's signals. If you experience pain, take breaks and use OTC medicines as needed. Balancing activity with rest is key to preventing injuries and maintaining foot health. Traveling often involves long periods of walking or standing, which can trigger foot pain. Pack comfortable shoes and consider bringing OTC pain relievers or topical creams for relief. Take breaks to rest your feet, stretch, and elevate them when possible. Planning ahead can make your travels more comfortable and enjoyable. If your job requires standing or walking for long hours, foot pain can become a daily challenge. Use cushioned mats, wear supportive shoes, and take short breaks to sit or stretch. OTC pain relievers and topical creams can help manage discomfort during busy workdays. Prioritizing foot care at work can improve your comfort and productivity. Athletes are prone to foot pain from overuse, injuries, or improper footwear. OTC, NSAIDs, and topical treatments can help manage pain and inflammation. Proper warm-up, cool-down, and wearing sport-specific shoes are essential for prevention. If pain persists, consult a sports medicine specialist for further evaluation. Children can experience foot pain from growth spurts, injuries, or improper footwear. OTC pain relievers are generally safe when used at the correct dose for age and weight. Encourage children to wear well-fitting shoes and take breaks during physical activity. If pain is persistent or severe, consult a pediatrician for further assessment. Pregnant women often experience foot pain due to weight gain and hormonal changes. OTC pain relievers like acetaminophen are generally considered safe, but always consult your doctor before use. Supportive footwear, rest, and gentle stretching can also help manage discomfort during pregnancy. Older adults are more likely to experience foot pain due to age-related changes, arthritis, or chronic conditions. OTC medicines can help, but dosages may need adjustment. Regular foot care, proper footwear, and balance exercises are important for maintaining mobility and preventing falls. There are many myths about foot pain and its treatment. Some believe that pain is a normal part of aging, or that rest is always the best solution. In reality, many causes of foot pain are treatable, and staying active is often beneficial. Don't let misconceptions prevent you from seeking effective relief and proper care. To recap, the most commonly used OTC medicines for foot pain include acetaminophen, NSAIDs like Ibuprofen and Naproxen, and various topical analgesics. Each option has its benefits and considerations, so choose the one that best fits your needs and health profile. Remember to follow dosing instructions and consult a healthcare provider if you have any concerns. Foot pain can be frustrating, but with the right combination of OTC medicines, self-care strategies, and preventive measures, most people can find relief. Always listen to your body, use medicines responsibly, and don't hesitate to seek professional advice if needed. Taking care of your feet is an investment in your overall health and well-being.